as we already heard, the main challenge in implementing deep learning approaches in the medical community is obtaining annotated data, and actually high quality annotated data. So if in other tracks in this conference we can hear a lot about large databases with annotated data, the annotation process is quite simple. Either you should say this is a car or this is a motorcycle, and then the question that we ask is whether this next image is a car or motorcycle or something else. When we are moving to the medical field, the question became way more complex on one hand, and on the other hand, it's way more challenging to obtain high quality data. And even if we have the ability to obtain such data, we still end up with insufficient amounts of such data. It's very expensive to get it because annotations are done not by regular people. These annotations need to be done by trained radiologists or other medical experts, which are very expensive. And also, different labels share a lot of similar properties. So it's very hard to move forward with supervised learning approaches in the medical setting. I'm not saying it's impossible, it's definitely possible, but it's more challenging. Today, I would like to present alternatives which don't aim to solve all the challenges in the medical imaging domain, but maybe some of them. So what we proposed is to use unsupervised learning in the medical setting. And the key idea is that we can quite easily model the normal appearance of images using autoencoders by training them with only samples taken out from a normal distribution. So only healthy population data should be used in the training. And by using the autoencoder, we can learn some representation which represent actually the normal distribution. And then, once we get a new image, we can forward it through the autoencoder, and because the autoencoder learns the normal representation, we will basically will get a reconstruction error between the output of the encoder and the input of the autoencoder, and the reconstruction error will communicate to us or will describe us the amount of abnormality in that image. So in this very simple example, we see a cross-sectional image of a coronary artery. So the central bright region is a coronary artery. It's bright because iodine appears bright in CT images. And we have on the left side the input to the autoencoder, and in the right side, the output of the autoencoder. And because this coronary artery cross-section is normal, the difference between the input and the output is minimal, and therefore we can assume that in that case, this image can be considered normal. However, when we start to provide the autoencoder with images that include abnormalities that the autoencoder was not able to see during the training phase, then it will fail to reconstruct the image back. And then there will be a difference between the input to the autoencoder and the output that the autoencoder reconstructed. And here we can see quite nicely that the difference between the input and the output appears quite nicely. And if we move forward to another example with severe stenosis, so there is a calcification in the coronary artery, then the autoencoder will almost completely fail to reconstruct the image, which means this image is abnormal and should be treated differently, or maybe try the patient, as we heard before, or different guidance to the medical team, but we can definitely do that automatically. And the question that we are interested to discuss now is not just the application, but is a more basic question, how we can encourage the autoencoder to learn a useful representation which actually represent only the normal distribution of normal patients or normal populations. So one way to do that is considered called contractive autoencoder, when we are limiting the number of variables or number of features in the bottleneck of the autoencoder. So we have the encoder, and then the decoder, and between them there is a bottleneck. And this bottleneck can be limited by the number of variables that we are allowing. And basically, we essentially compress the data, the input data, to the limited number of features that we are allowed in the bottleneck of the autoencoder. That's one approach. Other approach is to allow multiple variables in the bottleneck, but add a sparsity term to the loss function that will promote sparsity in the feature representation. So we allow multiple features, but only very few of them can be active in representing specific image. And all these type of methods already are presented in the literature, and people are using them. Other approach is, rather than to limit the number of variables in the bottleneck, is to look on the input image and stochastically corrupt them with noise. Therefore, we encourage the autoencoder to understand the structure that is present in the image, which is fixed, while ignore the noise, which is randomized through the training. So basically, at each time we take an image and put it in the training phase and pass it through the autoencoder, we corrupt it with different type of noise. Again, the noise can be parametric, like Gaussian noise or other model of noise, but the overall idea is to corrupt stochastically the input noise. Here we proposed other approach where we called the mixed structure regularization. So looking on the noise patterns that we suggested here, that we saw in denoising autoencoders, this noise is parametric at some level, and therefore, rather than we may encourage the autoencoder to learn the noise parameterization and actually denoise the noise that is in the input, rather than to really understanding the structure. So instead, we suggest to add random structure that is taken from our internal database and stochastically corrupt the input with that pattern rather than with some kind of parametric noise. So we have here, basically, we corrupt the data. We are not limit ourselves only to the structure that we mixed, but we can also add promote sparsity term promotion, and we can also add noise. So we ended up with an input that is both corrupted with parametric noise and with our structure. And this slide will show you the idea that we would like to promote here. So we have X on the most left column, which is the input data. We can either corrupt it with some Gaussian noise. We can also corrupt it on the third column with some structure, and we can mix all of them together, so both parametric noise and some kind of structure sample from the data. The fifth and the sixth column represent the structure that we are corrupting with and the noise that we are corrupting with. And you can see that the noise is parametric. We can easily see it, and the structure can be totally randomized and unpredictable. And that helps the autoencoder, or that encourages the autoencoder actually, to learn only the actual representation that is important, that really matter in representing normal appearance. It's important to emphasize that the weights that we are mixing the noise and the structure are very small, and therefore it's very, very hard to see the actual footprint of this noise and structure in the four left columns that you see in this figure. So we tried to apply this approach on a specific clinical task of detecting coronary artery disease. So the coronary arteries are the main vessels that supply blood to the cardiac muscle, and obviously they can get blocked by either fat or calcifications or other type of plaques. So using CT, we can easily depict both soft plaque, as you can see in the left panel, or calcified plaque, which appeared bright in the right panel, both indicated by the yellow arrows. And our goal is to automatically look or analyze on these coronary artery images that we get from the CT and determine whether this patient have some kind of abnormal appearance, probably related to coronary artery disease, that should be inspected by radiologist, or it's a healthy patient and we can discharge this patient to home quite fast. So we did an experiment. We got 90 data sets acquired with Philips CT scanners, either Brilliant 64 or ICT, different types of acquisition, either helical or axial scans. The processing was include common cardiac analysis pipeline, and we got from that the ground truth measurements of stenosis. We trained our data sets using only the healthy appearance cross-section, so less than 20% stenosis, and we defined two tasks. One was to distinguish between healthy and disease cross-sections. That's an easy, relatively easy task, and more challenging, detect cross-sections with stenosis above than 40%. So here's just an example of how that looks like. So the 3 panels at each part is basically the different views of the same coronary arteries from different angles, and the 4th row is the indications whether this is abnormal or not. And more importantly is the performance using the different types of autoencoders. So what we can see is that by using the mixed structure regularization approach, both the blue and the green curves of the ROC and the precision recall curves became way better compared to a sparsity autoencoder or sparsity and denoising autoencoder. I mean, using mixed structure regularization really encourage the autoencoder to learn the normal representation way efficient compared to traditional approaches. And we did that in a cross-validation fashion, so we were able to compare the area under the curve and the average precision measurements over the different faults, and we saw both, in both measurements, we saw a statistically significant difference, or improvement actually, by using our mixed structure regularization approach compared to sparsity and sparse denoising autoencoders. Now, similar was for other tasks, which I skip in terms of the time. Of course, the weight is an important parameter, and this one, the weight of the structures that we are incorporating is important, and we should be carefully choose it so we can incorporate such an experiment in our cross-validation framework. And this graph shows the influence. And basically, we can see that going beyond 0.1%, the structure contributing a lot to the overall performance of the autoencoders. So in summary, here we propose to use autoencoders to learn normal representations. We can detect abnormalities by considering them as outliers in the normal representation. And we promote the mixed structure regularization as a new way to encourage autoencoders to learn a normal representation. I would like also to highlight that this kind of mixed structure regularization can be applied as a data augmentation technique, not just for autoencoders, but for other deep learning tasks, such as classification or segmentation networks. Thank you.